Hello, Krakow. It's 3 a.m. in the morning, Saturday, 15th of March. And I woke up today at 3 a.m. in the morning because today I'm going to meet my friends Anya and Joe in Denver, Colorado. I think it's my taxi waiting for me.
First step, first flight to Frankfurt.
Hours to go.
Hey friends! Welcome to Denver!
Okay, so camera is over there. And okay, hello, welcome to my YouTube channel, The Holistic Way. Today I am at Anya's and Joel's place in Colorado, Denver. I'm so happy to be with my former patients. I just wanted today to take the opportunity to ask them about their feedback, like now, a few years later. What do they think about my approach? We are still in contact. Anna and Joe are one of my best friends now, so we talk a lot about therapy. And I want to just to ask them, like, first off, our first contact was in Krakow, Poland, in my office. They took an appointment, and I just wanted to ask them, like, just to remind me, because how did it happen? How did it happen exactly? How did you end up in my office?
So one day I asked one of my friends in Krakow, who was a former student of mine back when I taught English there, if he knew of a doctor that could look at Anya. And he says, "Oh, you have to talk to Sufyan." So he said, "You were an osteopath." I had no idea what an osteopath was, but we've been open to looking for therapies or treatments that could assist here. And so that's how we were introduced to you. And Anya went, and I went with her for a session while I waited in the waiting room. That was our first.
Actually, you were not meant to be treated that day.
I wasn't meant to be treated.
Yes, exactly. Because it was me that where I had an appointment, but it just happened you had a spot right after my appointment, and you also treated Joe.
Super. Yeah, that was a great memory. Now, like everything came back to my mind, and that was a great memory. So, that's a question for the both of you. When you came to my office, did you expect a particular approach or particular treatment before? What did you expect?
I absolutely had no idea what to expect, but at that point in my life, I was in pretty bad shape. So I was like, whatever they do to me or he does to me, I will trust the process, but I had no idea
Let's go.
how long, and nothing. I just went with a total belief and trust.
Super. That's super. And Joe, I believe you were like not even, you did not even expect to be treated, so you had no expectation at all, right?
No,
Yeah.
I had no idea
Yeah,
at
that's-
all what to expect.
Were you like basically that's for the both of you. Were you like right after the session? I mean, right after. Were you surprised by my approach?
I think I asked myself what just happened. Although I have a little bit of experience with this type of therapies, maybe 15 years ago, with a woman that we had met in Arvada, and she had done this energy healing, is what she had talked about. So there was some recollection of that, but
Still different.
still quite different.
Yeah.
But I remember thinking, okay, I have had a similar experience before. And after it was all done, I wasn't exactly sure what to think.
Okay. And you?
Actually, I was a little surprised that all what it took to be just laying on the table and I didn't have to do anything. You
Yeah.
did all the work, right?
Okay, yeah.
And so, like I said, like I mentioned before, I had no idea what to expect. This was like, wow, it's almost like too easy.
Yeah.
It was like too easy, and but it was very relaxing, and I guess that's what I remember. It was very relaxing, and
Funny you mentioned about that because like people would expect like if it works, if it's strong, if it's to expect like strong benefit, something have to be strong. Like a light technique wouldn't give you good result.
exactly,
It's too light.
it was
actually.
surprising.
Yeah,
There was
yeah.
that light, and almost like nothing happened, but it happened.
Yeah.
And
It's very
I
common.
was maybe thinking about osteopath, connecting it maybe to chiropractor. And I was thinking, oh, I'll be twisted, I'll be pushed on, I will be like,
That's classic.
maybe it will be hurt,
Yeah,
it will be painful. But nope,
No, not even.
it was like almost like getting a massage.
Yeah, thank you for the answer. And okay, so if you think about that kind of therapy with a bigger perspective now, we are like more practically 2 years late after that session.
right.
Yeah. What is your feedback about that type of approach nowadays, like today now? What do you think about that approach? In
You
more
go first.
longer perspective.
I think it's holistic. I think it's full body. My experience going to conventional medicine is they'll address a certain specific item that you have an issue with, but I believe that you take a full approach, the whole body. And this isn't something, I think most people will not be accustomed to this approach, and so as a result they may think, well, you have to believe in this to happen, or this has nothing to do with belief. This has everything to do with just having an open mind to a different approach. That's all. And I think if you can do that, you can expect different results. And I think we've received those. And the fact that when you got done with me that day, I came in with a hip issue. You addressed so many other issues, and that everything's attached. And I think that was my first experience of having treatment for one thing, but really receiving a complete analysis on everything, since it's interconnected. So that really made it feel beneficial during my session with you.
Super, thank you. Anya, would you say
I just
like
will,
2 years?
yeah,
after
I
that?
will just add that I strongly believe that everything is connected, and if you treat one thing, it may help for a little bit, but the real issue comes from a different organ or somewhere else, and eventually that symptom is going to come back. So treating the whole body is brilliant, really, because you address hidden issues that you didn't even know you had. So it's really 2 years later, I believe that is the best approach.
I just want to mention about something from what I remember. you were the one that was treated. You were treated first, sorry, and you get back, and tell me if I'm wrong. And you went like right away to talk to Joe, and you told him you should try. And from what I remember, Joe said, "No, no, I'm fine. No, just
Yes.
leave me. No, no, no." And you convinced him, and eventually he came. He tried. So why am I mentioning about that? I'm mentioning about that because it's not like you don't need to believe because from what I remember, you told me that you went for a walk and you felt like relieved from tension right away. Even at the beginning, you had like some skepticism. So you don't need to believe so it works. It's just,
I think that's when I talk to people about this. I think they haven't heard anything like this before, and so you constantly get into this discussion about, well, you have to believe for anything to work.
Yeah, I'm not a believer,
Yeah,
so
but-
it won't work.
But just, at this point, my experience with you is, I approach you like any doctor that I've had, although I know that you're going to address my full body. And I've always been pragmatic. I've never been a person who, although I'm changing, I just feel like this is a interesting approach. All you have to be is open to it, and
try.
you'll see the results.
try
Exactly.
it,
Yeah.
and we will
And
see
try it and
See the results.
and speak for yourself, because I think you have two different people here. Joe, like he mentioned, he's like, oh, okay, I've been pragmatic all my life. I am more open to that kind of approach. I tried different things in the past, and I just deeply believe this is for me. This is how I want to do it, because Western doctors, I'm sorry, but I've tried all of them. Testing, pills, and anything, nothing worked. And until I had a session with you. So
Thank you. Thank you. Would you say that even though you were believing, did it like bring still some change in your vision about what a soft approach would bring you, what it can heal, how it can help you? So did it bring you additional like evidence or experience so you would, even if you're a believer, you would trust even more
Still
or
be so-
less or whatever?
absolutely. I think, yes, I always been open. I am a believer in natural approach to heal your body. But what it absolutely surprised me, how quick I thought, okay, this has to settle in my body and needs time. I would just mention about the gluten intolerance, that absolutely I could not eat any gluten. My stomach would get super big and twisting with pain. And you treated me and you told me, go eat bread. And I was like, what? Do you want me to hurt? And I remember what you said. It was so amazing, because he's like, how are you going to know if my treatment worked? And
Makes sense.
it makes sense. I'm like, okay, I love bread. So I ran to the Polish bakery and I got a loaf of bread and I ate first piece, second piece. And my sister looked at me. I'm like, you have no reaction? Half an hour later, none.
Oh,
And
for sure.
that's what it was. It was so surprising that immediately after the session, within 2 hours, I ate gluten and I had no reaction to this day.
Yeah.
Really,
Yeah.
2 years later.
Wow.
Actually, I just ate piece of bread. Here I am.
You're good.
So,
Are you good?
yes, I'm very good, and I believe I will be. So
Thank you for sharing this
Yeah.
experience. And Joe, like same question. I would just like phrase it like differently. I mean, I would tell you, did your global vision about how the body works, how the health, how you can recover from something change
until like from that time, do you have now a different vision about health and how you can recover?
I think the biggest thing I've learned in this whole experience with your treatment is how emotional trauma can create adverse health effects. I think that we walk through life going through stressful situations, not thinking that it has or can have an issue or an impact on your body. Yes, we feel stress, and you try to deal with that. But the fact that maybe an event that occurred in my life created some tension or stress in a certain organ, and it's been holding on to that, I think that's my biggest epiphany in all of this, is recognizing that the tension in your body is a domino effect that can create other issues. And so I think what happens, the treatments that I've always had have been the result of the tension, not the tension. And I think what you've done is you have gone back to that source that has created those things. I think that's the biggest difference that's opened up my mind and understanding of healthcare and being treated. So, reflecting on a time that I may have had that has started this tension to give me the ailments I've had has been really very, very surprising. I never in a million years thought about it that way.
So, like root cause versus effect, right?
Yeah, exactly. I think you're going that one step further to the core of the issue, I think, and versus just treating the symptoms.
Oh my gosh, you just actually
Yeah,
said
yeah.
what I
Thank
want
you.
to say.
I just want to ask you still one thing, like few questions. I would be somebody that never heard about the kind of therapy. I would come to you. I have never heard about that kind of treatment, like the kind of treatment I'm providing, and I would ask you, hello Joe or hello Anya, what the word holistic mean to you
In healthcare, I mean,
in healthcare? Yeah. Like, give me a definition according to what you know nowadays about holistic. What holistic would be different from something you would classically know? Or
I would say that holistic to me, if you can envision a swimming pool, and the swimming pool has swim lanes in it, so each section of pool is cut off by a buoy all the way down. I think that the way that I look at it as it's the entire pool versus just the swim lane. I've always understood the term holistic, but I never understood it in the terminology that you've used it, because I had swim lanes around my holisticness. So here's my skeleton, that's one big from head to toe. Here are my organs, that's over here, that's another swim lane, and here's other things. This has opened my eyes, just as I mentioned before, how emotions and emotional trauma can affect my organs, then affect my skeleton. It's a whole pool. So I think that that's what I've understood, is I have a deeper understanding of holistic now versus just maybe just one section of that pool or just the surface of that pool. I now understand the depths of it. So if that makes any sense.
Wow, that's very
Thank you.
well said.
That's
Yeah.
super example. I love your example with the pool and the lines, and you could just break the lines and say, why should I stick this
To
line?
just one, yeah.
Because maybe my problem is in the other line, so I want no.
Let's treat the whole pool.
Yeah. Yeah.
No, that
bound-
was brilliant how you
Yeah.
say. I don't know
Thank
if I
you.
can beat that. But
Let's try.
let's try.
Anyway, yeah.
Holistic to me is basically going back to natural state of what the body is meant to be. And unfortunately, through traumas, sicknesses and all of it that we stress and all of it, the natural way the body is supposed to work gets little, the lines in a pool are put in, and going back to the natural state is finding a way to remove the obstacles, something that it's holding us back from being and feeling the best we can feel. So without just covering the symptoms, like treating the symptoms only. It's basically you treat when you have a wound in you, like let's say on your arm, it's not just putting a band-aid over it, oh, it will be okay, because there could be an infection that has to be treated. Holistic to me is treating the infection deep in the body versus the traditional way, just slapping the band-aid on and hopefully it will work.
Yeah.
So that's
Thank
what
you.
I think.
Just one or two more questions. First off, I want to thank you for sharing your experience with the Holistic Channel. And if there is something like now, I want to ask you if there's something you would love to add, or you just want to mention about something, like, because from my experience, people would assume things about that kind of approach, or maybe they would say, "I'm having symptoms. It's not have nothing to do with your therapy." So, and sometimes people would be surprised about how many problems this kind of approach can handle. Just a word about the things you were surprised about, what that kind of therapy can also heal. And
So I went in for a hip problem, and what's interesting to me is I've been breathless doing yard work, and you were able to address why. That has nothing to do with my hip. And that was during one session. And we found that I had tension around my heart. And it's true. I couldn't believe what issue I was having. And then when you talk about cravings and how certain blockages within an organ can create a craving. And yes, I have created sweets because of stress that caused tension in, I can't remember the organ, was the pancreas?
the pancreas, yeah.
So, one session addressed all of those issues. And the questions of, why am I breathless? Why am I craving sweets? I don't like sweets, but I have been craving them. And I have been breathless. So I didn't go in there for those therapies. I went in for my hip. So the term holistic, that kind of touches upon that as well. But I think what's really great is that you go in there and all you have to be is open. Just like being open to driving to work a different way. That's really as simple as it is. We all drive the same way to work every day. It's how we do it. But just to kind of change things a little bit, it benefits you from driving a different way. I think there's a very similar here point to make, that we're not conditioned to receive therapies the way that you administer it. And just because it's not the same doesn't mean it's voodoo or witchcraft or anything. It isn't. It's just that we're not exposed to it. So just get exposed to it and open your mind to it, because it has great benefits versus the alternative, which is, that'll have bad consequences. That's the first thing that we kind of think about when we try something new. Oh, it's going to be bad. Oh, what about approaching and saying, oh, it's going to be great? And that's what I've experienced.
Thank you.
Yeah.
Please.
For what I would say is, why not try? Even if you have some doubts, it's like, I don't think this will work for my specific issue, is you don't know until you try it. And give it a chance, because it has absolutely no side effects. just think about taking antibiotic. It has pretty bad side effects, and you take it. Somehow you take it and you are not afraid of taking antibiotic, but trying something that has no side effects, but 90 or like even 100% it will benefit you. Just basically, like Joe said, go with an open mind and try it yourself, because you can hear those stories, my story, Joe's story, or somebody else's story. This is a proof that this works amazingly, but you have to try it yourself, because words are words, but like when you get on the table and you get up and you feel, like in my case, the benefit right away, hello bread, then you will know, and you can pass the message to somebody else who can be helped.
Thank you. So I really thank you for sharing your experience, and I really needed the patient's point of view, because I'm the therapist, and sometimes it's good also to have to talk about the patient's perspective, which is sometimes different. And I'm so happy that you like that therapy and that it helped you. I hope it helps you, and I'm really glad about that. So I hope I will keep bringing some improvement to this, because this kind of therapy you learn all your life, you improve all your life, and you improve patient health all your lives. And I'm so happy, and I'm so happy to know you. You are a great friends of mine, and osteopathy leads also to friendship and to happiness.
Absolutely.
Yeah.
Yeah, thank you for having us.
Thank you.
And I'm glad to be part of the healing.
Thank you so much.
Thank you.
So goodbye, and see you next
Bye-bye.
time. Bye.